Dr. Stafford, how in the world did you get started with the Rife technology?
Ed, it's a very interesting experience that I had. I'd been in the service in World War II and Korean War and the Naval Reserve, and was out and started my practice. I had 2 partners, and early in 1950s, it was my turn to take the Saturday afternoon patient group load, and I was in the office, and the last patient came in happened to be a John Marsh. Now, I and my father before me had doctored the Marsh family for a long time. I hadn't seen John Marsh for quite a while, and I said, "John, what are you doing?" He had some little thing I needed attention. I said, "What are you doing now?" He said, "Well, I'm out in California, Bob." He said, "I'm in a business to put you out of business." I said, "Well, that was certainly a good introduction to this subject, because it caught my attention, even at the end of a long afternoon in the office, seeing patients." So I said, "John, tell me what this is," and he continued to talk about the Rojala Raifa experience, and he made claims that if this machine and this information, this knowledge could be put into a radio station and transmit over the population, it would help all the people in the area would feel better. And he didn't go into the electromagnetic fields, but that's what it was. We are surrounded electromagnetic fields. We know now. I know a lot more about it than I did then. I was just practicing medicine. So this came in and brought some physics into this thing, in this life of mine. And he claimed that this Rife treatment could cure cancer. Well, I said, "Now, John, you're pushing me a little bit here." I said, "But I'll believe this if I could see it work." He said, he said, "Well, I'll bring a machine out if you ever have a patient." Well, as fortune would have it, it was 2 or 3 months I did have a patient at a small hospital, College Hill Hospital, and she was admitted because she was in the terminal stages of cancer. It was breast cancer that had spread to the lymph nodes around the thorax, and the lymph nodes around the esophagus and the trachea. And she wasn't able to eat much, to just take liquids, and she was in a very bad shape. So her husband, now this lady was in her early 80s, and her husband was about the same age, and he said to me, he pleaded, "Isn't there anything more we can do for my wife?" So I told him about this experience I'd had with John Marsh and the Rife machine, who he claimed would cure cancer. He said, "Bring him here. Have him bring the machine here." He says, "I'll pay for everything." And I said, "I don't think there'll be any charges, but I will certainly contact him." And sure enough, John Marsh brought one of the original Rife machines with the bulb that was attached to it, and he brought it to my house after driving 3 days right straight through from California. I said, "John, come on, you got the machine, let's look at it." This was in the evening, and the cancer patient was still in the hospital at College Hill Hospital, and she knew that we were bringing something for her. And I said, "John, my dog has been failing. I had a black cocker dog, Skipper. I'd gotten him while I was in the Navy. And he was just one of the family, but he'd been aging. He was about 10, 11 years old at the time, and he'd gotten progressively weaker. His back would tremble when he'd eat, and he used to be able to jump into the car. And as a matter of fact, one time my wife was driving downtown, it was hot in the car, And he jumped out of the car right at the firehouse at 3rd and Main, Monument and Main in Dayton here, and it was too hot in the car, so she went around the block, and sure enough, he was waiting for her to come back. She opened the door, he jumped in, but this dog gotten weaker and weaker, and he couldn't do that anymore. And I said, John, treat my dog. If this is so wonderful, if it does everything you say, let's see what it does to this dog. So he said, sure. So we brought old Skipper in the room, and he took this machine, turned it on, and did some things with the dials, and light patched that, and it began to glow, and we worked over the dog. The dog would do anything I said. I told him to be still, and he was still. I think he felt good. And so, lo and behold, to shorten this a little bit, by the end of a week, this dog his energy had come back. He could jump in the car now, like he used to. I could take him to the hospital and let him outside of the door, and he decided he'd come back home. And Dayton isn't that big a town, but it's pretty good for a dog to be able to find his way around. And he began to do things like that again. He could go from our office back to the house. A remarkable dog. He was trained in the Navy. So anyway, he showed new vigor, and he would set up to beg for a graham cracker, which was his favorite thing to eat. And so I was impressed. And the next day, after the first treatment of the dog, before he really had shown all this improvement, we took the machine over to College Hill Hospital and established it there at the patient's bed. And John Marsh proceeded to operate the machine on this cancer. Let's call Mrs. B. Let's call her Mrs. B. That was the first initial of her last name. Mrs. B was very weak, and she had gotten where she couldn't swallow any food, as I said a few minutes ago. She just took liquids, and she was wasting away a little. So John, to summarize this, John treated Mrs. B. We treated her every other day with the Rifle machine, the original machine, at the bedside. And I was chief of staff over there, so I could get by with this. Nobody asked me any questions. It was a small hospital. And so after she got 3 treatments, and then John had to go back to California, so I continued the treatment for another 2 more weeks, reduced every 3rd day, I think. And she became much better, and she began to eat. She ate so she was so hungry from being partially starved that she made her husband go out to McDonald's or whatever was on at that time. I don't think we had McDonald's then, but one of those kind of fast food things, and bring her hamburgers. And her energy came back like the dog's energy, and she began to eat. Now, before to preface this, I should have said, before we treated her, I had a surgeon that I knew well to come over and biopsy some of the metastatic lesions that she had on her chest wall and up in the neck. Took out a lymph gland. These were sent to 2 laboratories here in Dayton. One laboratory was run by the coroner of Montgomery County, Dr. Zip. I thought it would be well to have him on my side if something went wrong with this thing. And the other was a private lab, Dr. Zip's lab. I'm sorry, Dr. Dilley's lab. Dr. Zip's lab and Dr. Dilley's lab got specimens of this biopsy node and the biopsy of the skin where the metastatic cancer had spread. Well, these reports came back, metastatic cancer of the breast, as we suspected. And this was just before the treatment. When I knew we were going to give her treatment, I had photographs made and so forth. So we confirmed this. And after the treatments, and several months went by, Mrs. Bias the patient got better.
Yes.
And well enough, she wanted to go home. So she went home. And then she was home for several weeks or two or so, and she fell down at home, and she broke her bone in her leg, and this was a very great shock, and she regressed from then on, and in time, in another 2 months or so, she died, and I had an autopsy done, and Dr. Zip was involved in this, the coroner's case, and he found he was amazed that he did not find evidence of any more breast cancer in the nodes, in the paratracheal nodes, and the periesophageal nodes, or the skin even had cleared up. There was the site of the original cancer. There was a little identifiable breast cancer still at the subareolar area there, in her left breast. And so this impressed the coroner and impressed everybody that had been a part of this. And Dr. Zip was doing experimental work on Thiotepa over at Miami Valley at the time, and he had a grant for a special kind of Sprague Rally rats that he was using Thiotepa. And these rats will accept cancer, lymphomas and so on. So his work was with these rats. And Zip said, I will take 10 of these rats. Actually, they had controls going out almost on what happened when you injected these cancers, Sprague Rally cancer, in these rats. And so he said, we'll run this. Before we take the machine in there, though, I want to take the machine out to Monsanto labs and have them out there, well known out there, have them tested for radiation and so on, so that we know what we're working with, and we're not being exposed to X-ray or something that we don't understand, gamma rays and so on. So he did that. He had the machine tested at the Monsanto laboratories, which was experimenting with the plutonium, I believe, the bomb, for the atomic bomb fusion, so on. So they were very, very well qualified to do this testing, and they gave it a clean bill of health as far as any radiation exposure risks. And this was very important because he didn't want to use this in the rat experiment over at Miami Valley until he knew exactly what was coming out of this machine, especially radiation, so that people wouldn't be exposed improperly. So we took the machine over to the valley, and his PhD that was working there on the project worked with us on it. And I went over every other day and gave these treatments to these rats. And actually with 3 groups. The one group of 10 were treated, injected with the Sprague cancer, and then those are the ones that we treated. But we also treated another group of 10 that we didn't inoculate with the cancer, just to be sure what the effect the machine would have on the group of rats that weren't infected with the cancer. To summarize this, Dr. Zip said that if it has any effect, I would be impressed if any of these rats, these 10 rats who were injected and treated, would be alive after 45 days. They just died. He knew how long they died. Had been working with this federal grant for quite a while. So we treated the rats, and as I just said, and on the 100th day, a third, 10 rats, and 3 of them died in about 40 days with cancer, and the lab, the PhD, autopsied every rat that died, and they found cancer in 3 of the 10 that were injected and treated, hadn't affected them. A couple rats lived on into the 50 days at a time. I think 54 days, 54 days, 55 days. And there were finally one of those that lived on into that group began to show retro-orbital back of the eye growth, making protrusion in the eye, and that began to recede. So that rat, we knew, took the cancer injections, and something was causing it to get better. The cancer was growing behind the orbit, the eye. So they were impressed with that. But three more rats lived to the 100th day, and Dr. Zip called me and said, Bob, he said, this is amazing that at least 3 of these look perfectly healthy, and the one with the eye is still alive. He said, I'll go on if you want, feeding them and looking at them, but I'm impressed. And he said, I said, if you're convinced that we've done something here worthwhile, he suggested that we go ahead and autopsy, kill the remaining rats and autopsy them. And we did, and there was no cancer in 4 of these rats. The one, the retroorbital cancer, or bulging evidence of growth, that had cleared, and the other 3 rats showed no sign of any cancer. So he was impressed, and we were all impressed in this, and I took the machine then into our office, and I did with some selected patients. I explained to them that this was an experimental procedure, but that there was some evidence that it would help in some cystitis, some of the bronchitis, and so forth, some of the minor ailments that you see in general practice. And I took it in there, and over a period of 3 to 4 months, I treated a number of people with some results, but this was a testimonial kind of thing, and it didn't really add up to anything for a medical journal or anything like that. But then my partners, my other 2 partners, got together and thought maybe we were exposing ourselves to some malpractice risks, and they said, we want the machine out. While the office belonged to me and my family, I didn't want to lose my partners, so I took the machine out, took it home, and I brought it back to my house, and while I was there, of course, I had the opportunity to treat a few people, including myself, and I will just give one example. I have a tennis court in the backyard, and it freezes over in the winter. We flood with water, and we skate out there. And one day, it was a Wednesday morning, it was my turn in the office, and I woke up with the flu, I guess. I was aching all over and chilling, and it was my turn to go down to the office. I've only missed one day of work in my life when I was supposed to be somewhere. And so I went out to shovel the snow. It had snowed over the ice, and you have to keep that off if you want to continue to use the ice. So I went out to shovel snow with the chills and shakes. When I came in, I was worse. It was time to go to the office. I had the machine, I put it on me, and I sat in a rocking chair. That's the rocking chair right there I sat in. And I turned it on, and I rocked forward and back to get a full block effect of the machine. And I gave it, turned the dials as I went through this routine, which I knew pretty well by this time. And I felt better. I felt better, and by the time I could get dressed and was on, I went to the office and felt fine the rest of the day. I can't help but feel that this treatment blocked something that was coming on me, like the flu or whatever. Again, it's a testimonial, but I will summarize at the end part of the reason that I think it'd be worth telling you this. We treated a number of people, treated poison ivy, dermatitis, and so on and so forth, and bronchitis and flu, all things of that nature, minor things. But because of the success of the rat and the work with the original Mrs. B, and there was another patient in her room I didn't tell you about, but the machine, she had had cancer and had surgery for cancer of the uterus, the cervix. And the cervix, the cancer had spread to her abdominal nodes, and she had had an extensive irradiation at another hospital, Miami Valley Hospital. But she was sent over to College Hill Hospital and was put in the same room with Mrs. B, my patient. And when her husband saw what happened to Mrs. B, I'm regressing a little and out of context at times, but it fits. And her husband said, "Won't you treat my patient, my wife?" And I said, "I'll treat your wife if the patient's doctor will permit it in writing." And so he got the patient's doctor to say, "Yes, go ahead." There was nothing to lose. This patient was slipping fast, and she was having hemorrhaging through the burns from the vaginal rectal mucosas and so on. And she was developing some hydronephrosis, and so the treatment on this Mrs. C, which is next to Mrs. B, Mrs. C, the bleeding stopped, and she also went home and was not followed up, and she went into uremia because an autopsy showed that she had an advanced obstructive uropathy leading to uremia, and she died from that. She didn't die from her cancer, but we can't say that this machine cured any cancer. We can say that they didn't find any when they did the autopsy in the abdomen of Mrs. C. So that was the total experience over at College Hill Hospital. And then we had all these more minor things that you would see in family practice, general practice. So, and I treated a couple more dogs. One of my nurses, the head nurse there, had a dog that developed sores, and the veterinarian said it was a cancer of the foot of the dog, and it was getting worse, and she had seen me treat the patient in the office. She said, "Won't you treat my dog?" I said, "Sure, I'll treat your dog." So I treated her dog's foot and the dog's foot began to heal and got better, and I have a signed statement. I said, "Give me a signed statement about this." Martha is her name, and Martha Swanton, and she was a very good nurse, and she was straight arrow. She wouldn't lie about anything. So it did help that. And another nurse, when I was doing a tonsillectomy at Good Samaritan Hospital, I heard this nurse, rotating, circulating nurse, talking to the other nurses as they do during surgery, keep from being bored, and I was doing this tonsil operation. I heard her saying how bad her collie dog was. The dog was failing. She'd had it to the vet, and she had her own apartment about 2 blocks from her own home. She wasn't married at that time, and she was very sad about the dog was getting where he couldn't even go from one house to another. It was just getting weaker and weaker. The vet couldn't seem to do anything for it. So, by the way, I'm not a veterinarian. I'm a medical doctor, graduated at Cincinnati School of Medicine, and was taken into the service, Naval Medical Reserve, spent some time in World War II, and then again in Korea. So I've been through that, and an intern residency in the hospitals at Dayton, and a general rotating internship and a medical residency. So when I got out of the service in the late 48, after the little stint in Korea, I was ready to go at dental practice and so on and so forth. And that's where we are now in this little dialogue. Now, I've been wondering a bit, but I've been building the situation to show that we've used this machine, the Rife machine, and his frequency on a number of animals and people. After all this, I brought the machine home and didn't do much more with it. I did treat my son one morning. My wife and I were going to Chicago to continue the medical education meeting, and we'd be there a week, and my mother and aunt had come up to take care of the 4 kids. My little boy was about 3 years old, and he awakened 3 to 4, and he awakened with a high fever. And well, of course, obviously we were not going to Chicago while he was sick. And I didn't know, most fevers get better, but it takes a day or two when you see a situation like this. My aunt, my aunt, said, "Why don't you treat your son, David, with the machine? I'll hold him and we'll rock in the chair and give him a treatment." By this time I was convinced it was not. I had seen no detrimental effects from the machine. I had seen no one present with anything that was suspiciously harmed by these treatments. So with that explanation, I treated David, and this is hard to believe if you hadn't seen it, but within an hour his temperature was down to normal. He was upright and crispy, and we waited a few hours, and he was okay. And so we went on to Chicago that afternoon to continue medical education, and kept in touch with by phone. But he never had any trouble like that. My daughter, who was in the Scotchettes at Fairview here in Dayton, and they get out and do all those things in the drum fields with the bands and so on. And she was practicing in the fields over there and developed a bad case of poison ivy. And I'd heard that this was good, and I'd seen it work on some dermatology things. I said, "Ann, let's treat this." And so we treated her and one of her colleagues who also got poison ivy. And it just dried this poison ivy. She was miserable with it. It's spreading and wet. And it dried it up. In a couple days, she was feeling well, and just a few residual lesions, but no scars or anything of that sort. So again, another 2 cases of my own family where no residuals, both are living and well and have children of their own with no chromosomal defects, or have 10 grandchildren. And I have been very fortunate not to have any evidence of any chromosomal defects in our children or our grandchildren, which is an important thing. I didn't use them to prove that, but it's just the way it turned out. And I think that, with the help of the good Lord, we were very fortunate to have a family that has no serious illnesses and no illnesses that could be attributed to chromosomal aberrations that might have occurred from the use of this machine. Ed, do you have any questions? You've heard me talk about some of these things. Anything more that you want me to cover, or have I?
Could you talk about your experience with someone from the federal or some agency of the government that came to inquire about your activities?
I'd be glad to talk about that. There were rumors, and I think a paperback came out once that said that I had lost my license. Isn't that right?
Yes.
A paperback. Without consulting me, I saw that I'd lost my license. Well, I have never lost my license. I am still a licensed physician in the state of Ohio. and have a DEA number and all those things that we like, and I'm certified. I have my continuing medical education certificates and recertifications and so forth and so on. But along about, we've had all this experience, and this probably an agent from the Drug Enforcement Agency, DEA, I do believe. And he said, "Doctor, could I understand you're working with an experimental machine, something called the Bife machine or something like that." I said, "That's right. I have been." Well, he said, "Could I talk with you, have an interview with you?" I said, "Sure. How about next Wednesday afternoon? Come out to my house, we'll talk as long as you want to talk." Which he did. He came out, and I brought out my data that had been accumulating, 2 boxes of them, and answered his questions and showed him data to support what I was saying, somewhat what I'm telling you here, plus a lot more. I talked with Dr. Swan, Lieutenant Colonel Swan in the medical department at Wright-Patterson Air Force Hospital, and he was very interested in this, but he unfortunately had been transferred to Texas, and we couldn't continue. I was hoping to get Wright-Patterson involved in this. But all of this data was in the information that I showed the DEA agent, and we sat here and I'm looking at the table where we sat, the dining room table right over here, where we sat for about 3 hours, and he said, "Well, Dr. Stafford," he said, "this is very interesting, but," he said, I would hope you would give me the machine. I think we should have that machine." So I said, "I cannot give you the machine. It's not my machine to give. It belongs to folks out in California." Well, he said, "I might have to take you to a federal, before a court, or a judge, federal judge, to get a rule on it." I said, "Well, that'd be fine. I just love to go to court and tell you, the court, all that I've told you and some more besides." Well, he said, "Maybe we don't have to do that." He said, "Could I borrow some of this data and take it back and show it to my people?" I said, "You can take any part of it that you want as long as you sign out each sheet for me, so I can claim it that you have it." Well, I'll do that. And he wasn't too happy about signing anything, but he did. That's the only way he would have gotten anything, without taking me to court, and he didn't want to do that. So, but I think that he left here with many of his questions that he may have had resolved from his standpoint. I don't know. We left friendly. He didn't get what he wanted. He didn't get the machine, and he got some evidence that he could show to his superior somewhere. Well, it went on to it. I said, "I hope you will send it back to me." And so 2 or 3 months, I received all this data, every sheet of it back. No cover letter, no thank you letter, no nothing. He just got back all the material I loaned to this agent. I presume he was the DEA man. I'm presuming that. I've learned to be a little bit more suspicious, but I figured, I guess he showed me some credentials. I guess you can fake those things too. But anyway, that's what happened on that. One other time I was challenged, and that was by my own Montgomery County Medical Society. This was after the DEA man had been here, a year or 2 after. This occurred. One executive of the county said, "Dr. Stafford, excuse me, we're getting some questions from all over, in Montana and places, about you. Are you real? Are you a member of the society?" And I have to answer these, and of course you are. And but he says, "I've taken this up to the executive committee, and they think maybe some selected oncologists and radiologists should have a meeting with you sometime down here at the County Society." I said, "Whenever you want." Dr. Zip, who I mentioned earlier was an oncologist and a laboratory man. And Dr. Tai was a radiologist who'd worked on some of my people at Good Sam when we did our work there with the cancer people. So they were on this star chamber, I guess you could call it, of colleagues who sat down with me at the County Society and one evening, Friday evening, and they wanted to hear what I was doing, and they asked me questions, and their consensus was there was no evidence that they were censuring me in any way. They were just wanting to know what they could answer when they get phone calls about this and about me working in this field. So they said, well, we think maybe you may have gotten too deeply in the research when you're a practicing general practitioner, and that was before the days of the family doctor, which I am now, board certified and recertified as a family physician. But to me, I'm still a general practitioner. Do anything I could do, and as long as I could do it safely, and I've never been sued, and I've never had a malpractice suit. Again, this is what I'm very fortunate to have that. I've even worked at Wright-Patterson Air Force Hospital for 2 years and seen patients out there, and you knew that, didn't you? And the family practice division out there under the Spectrum program, which is contracted for the government to take care of the families of the active military at the base, and enjoyed it very much. And but I didn't use this machine out there at all. Of course, I didn't interject this media of treatment anywhere except in my practice, or as I've described here. And when that was never without having the patient sign that they realize that this is an experimental procedure and that no claims of its efficacy were being made. And I have all those signatures to back up anything that would happen accidentally. But nothing has happened adversely, and the star chamber of the radiologists and the otologists just strengthened it. If anything, it made my position at Good Sam much easier, because one of the pathologists there was on this group, the radiologist there was on this group, and they were glad to hear a little bit more about it. So it was a very friendly session. That's the closest I've ever come to being. My partners challenged me to get it out of the office, but I'll even say as a postscript, I'd forgotten. Dr. Oswald, one of the two partners, and his wife came down with the flu one time, much later, long after it's been in the office. And he told me, he said, "Could I come down and get a treatment from that machine?" I said, "Sure, bring your wife and we'll treat both of you." I still had the machine, and I treated them. And I'd forgotten I'd forgotten this, until he reminded one time when we were at dinner. He said, he asked me how the machine is coming along, and I told him. And he said, "Well, you remember you treated us?" I said, "I'd forgotten it." What happened? He says, "We got better." That's the closest we ever come. Those were the only incidents we've ever had that were adverse. I still believe in it. I tell you what, it has opened. May I speak a few more moments?
Sure, please do.
Or are you running out of tape or getting bored? Cameraman going to sleep? Is it 2 hours?
Yeah.
Is it?
Yeah.
Well, I just want to close by saying, may I do this?
Yes.
Okay. this has given me a whole new vision of the world, having seen the effects of electromagnetic fields. I've been more interested in than I would be normally as a doctor. And I've almost become a paraphysicist. But I learned that the great forces in nature are, the major force is electromagnetic force field. And we're living in an electromagnetic field. The stars are that, the radio waves are that, emanating from the heavens above, and who knows what comes from below. But there are two other minor forces, the nuclear forces. So the four forces, gravity, I always thought gravity was the major force, but no, electromagnetic force is the major force in the universe, and gravity is the minor force. Those are the two big forces, and then there's the nuclear forces, a major nuclear force and a minor nuclear force. And therefore, what we're seeing in the universe is duplicated in the cells. And who knows, is the universe duplicated elsewhere? These are questions that have come to me that I've been blessed with, I think, because I've had the exposure to Rife's philosophies, Rojala Rife's philosophies, and the exposure to others who are now interested in this too. And my friend Ed, who's sort of got me back into this. I drifted away, and we met at a party one time, a mutual friend, and Ed came up and says, "You're Dr. Stafford?" "Yeah." I said, "I'm Dr. Stafford." He said, "Oh, for goodness sake." So from there, he drew me back into this, because I had sort of put the thing aside. The machine was back in California, and the Rife machine that I had, they came and took it back, which is fine. And I got into other things. I became chief of staff at Good Sam, and I head of the Red Cross locally, and on the United Way board, and I was one of the first doctors to get on the visiting nurses board. It was all women, you know, but I guess they thought it was time to get a man on. And they made me a second vice president. Didn't even ask me. But I'd been a medical advisor for them, and it was understandable. So other things, it took my time, and I sort of laid this aside, and I'm very happy that Ed has sort of regenerated it, and interest in it, and has developed a following of friends and people know what. So thank you, Ed, for the opportunity to talk today. I've rambled a bit.
One last question, Doctor. Ed, what was the disposition of your records, of your data?
You want to hear this as it came? All right. It's a very sad story to tell you. There was what was his name? Do you remember Benson? Was it Benson? I didn't look it up. A fellow called me from Ann Arbor, and he said his son was going to the University of Michigan, Ann Arbor, and he'd heard about my work with the Rife machine, the Rife frequencies and so on. And he said his son was ill or something, and he wondered if and he talked a while, and then I got a second call from the same man. He said, "I'm up in Ann Arbor, and I could come to Dayton in a hurry," which is true. I wonder if you'd see me, and I could talk with you. So I said, "Well, come on down." It wasn't the first time I'd had somebody want to talk to me about this, and I've usually shared what I've known as much as I can. And so he came down, and I met him here at my house, and I called another a friend of mine who helped me a lot in designing, in looking at this, seeing the physics of this machine and so on, as well as Dr. Zip from Monsanto. He studied this, and I said, "Will you come over and meet with me? This fellow wants to talk about this. I just want you to evaluate his him whether we should share with him as much as we know. And so he did. He came, and then so I took all three of us over to the golf club where I'm a member, and we had lunch in a little room off the side where we could talk. And so we talked about what we had, and I said, well, he asked me if I had some data. I said, sure, I've got data on this. And it had been returned from the DEA, as I told you, some of it. All of it, all that I've had was in my attic in some boxes. So here was a man who seemed to be genuinely interested in looking into this. And I don't remember all the details, but my colleague in physics, when we came back to our house, and this fellow from Ann Arbor had his rented car out in the driveway, and I said to my colleague, I said, what do you think? Do you think he's valid, real, is genuine interest, and should we let him have loan him the couple boxes I have, big boxes of data we have? Well, he said, I think he's genuinely interested. So I said to him, I said, well, we will loan you all the data I have in the attic in some boxes. But the loan, I think someday I might want it back for some reason. That was one of the big mistakes in my life. I've made a lot of mistakes, but that was a mistake. We didn't read this guy, I don't think, right. And I think he was living in Reno, or that town just near Reno. It's a suburb. Carson City, that's it. And he said, well, I'll take it out to Carson City and I'll send it back to you. So I didn't make him sign for anything. So I gave him it, and he said, well, I'll send it back. And I got to think, well, if he's going back by airplane, he's got a lot of stuff to take with him, but that was his problem at that point. So when Ed F. got more interested in this, and we wanted to look at this data, I said, well, last I know, a fellow, I couldn't get hold of him, and he's in Carson City. So do you want to say a little bit about...
I drove out there and inquired, and I finally did get a phone number, and I called him, and he professed to have lost all of the data. That was in 1992.
Yeah. So that's where that work went, and unless we look at the DEA, search the DEA for what copies they may have made some copies, but there's what I have very little data here. It's just some correspondence, but none of the original research work. I have a summary that I've shown you and stuff like that. But that's about it. I don't have much more to say.
Thank you, kind of. No, I think that'll wrap up pretty tight. Thank you.
Thank you for listening.